What we're doing today is we're checking for skin cancer on women. We're not doing delicious things today. We're doing things that will save your life. We're out at Pinnacle Dermatology, which is off Chenal Parkway in West Little Rock, another female-owned business. Dr. Andrea Mabry is a medical doctor, and she is the dermatologist. And Stacy is our patient today. She actually works here in the office. And Dr. Mabry, we're going to talk about, now she looks like she's fair-skinned, dark-eyed, and dark-haired.
Dark hair.
Is she a candidate for skin cancer, or do you kind of look at any skin type for this?
So any skin type can develop skin cancer. Obviously, the lighter complexion people have
like you,
blonde hair, blue eyes, burned every time I got out in the sun, are at higher risk. However, any person can develop skin cancer, all the way to dark African-American type skin. In fact, Bob Marley died of melanoma.
Well, who knew that?
Exactly.
I had no idea. Okay.
Stacy is less likely to develop skin cancer than someone with blonde hair and blue eyes. However, she has risk factors, including family history of melanoma in a first-degree relative, and a history of tanning, including tanning bed use.
Okay. Shame on that. Well, let's start looking. What's the first thing you do? You start looking at moles, I would assume.
Right. Usually we start at the tippy top of the head. Skin cancers can happen in the hair. Not as likely, but
a bald person has to consider that.
Absolutely.
People who don't have hair.
And just checking, having your hairdresser tell you if there's any spots that she sees that she didn't see last time. It's always nice to have someone just look through your hair, and if there's any new spot, changing spot, symptomatic spot.
I'm looking. I'm 12 years away from a medical degree, so I'll tell you if I see anything. Thank you.
So
now, okay, there's a mole.
There's a mole. A little fleshy pigmented mole like this, that's not dark, perfect. This mole follows all our rules. Symmetric, has a normal regular border, even pigment and color, diameter is less than a pencil eraser, and as far as we know, it isn't changing or evolving.
Okay.
So these are a little darker, a little more concerning.
Oh, so the darker moles are more suspicious to you?
Typically.
Okay.
Typically. We'll keep moving around.
And so is this when you go to your doctor and you start showing everything?
Absolutely. Definitely come whenever you have a spot that's concerning. So this is a mole that's a little concerning.
Alert.
Exactly. Let's take a sample of this one because it's a little darker.
Okay.
She has a history of tanning. She has a family history of melanoma. The symmetry isn't perfect. Border isn't perfect. Color's a little darker.
Okay, we're going to wrap things up. You're going to have a biopsy, it sounds like. Max, you need to finish out with that. This is the information you need to know. If there's anything on your skin that's suspicious, call your dermatologist. In about 25 minutes, I'll tell you about a skin condition I have, one that our sharp-eyed viewers probably have recognized. We'll do that about 4:35. Back to you, Mal.